Designed to be a sustainable model for sharing equity and financial risk protection for the vulnerable through the provision of basic minimum package of health services at no cost at the point of care. The Basic Health Care Provision Fund, financed with not less than 1% of the Consolidated Revenue Fund and other grants, is part of the federal government's commitment towards achieving universal health coverage. Clementina Uchechukwu Chibweze Idam, who with support of International Budget Partnership (IBP) and the International Center for Investigative Reporting (ICIRO), visited some local government areas in Ebonyi State, report on the impact of the policy and the setbacks.
I like as they use the treat people.
Mr. Otefi Chukuma and Mrs. Nwori Njoko are some of the enrollees testifying of the impact of Basic Healthcare Provision Fund in Ebonyi State. For Mrs. Akwebi, ever since she came back from Abia State, she has been accessing the services at MDG Amata Akboha with the card she used to register in her former place.
I'm not too here, although I don't stay here, I stay in Aba, but when I came here with my card, they gave us injection. They treated us well, normal, so everything was okay. The way they are servicing is okay. So they inject me and my baby. So everything was free. Even the drugs they gave to us was free. The only thing that I don't like here is just that there's no doctor. Just something like lab in case if you want to run your baby test.
Available record from Ebonyi State Primary Healthcare Development Agency shows a rise in general attendance of rural dwellers at primary healthcare facilities from 1,327,422 in 2019 to 1,399,454 in 2020. That was when the program became fully operational with 3/4 of the plans implemented through 2 gateways. One is the Ebonyi State Primary Healthcare Development Agency and the other is the Ebonyi State Health Insurance Scheme. Both represent the 2 national gateways, as the third gateway for emergency care is yet to commence. 1 year later, there has been reduction. However, in 2021, attendance figures dipped to 1,356,566. As at August 2022, attendance stands at 808,255. The changes have been attributed to certain factors, including inconsistency in disbursement of funds to benefiting states from the Basic Healthcare Provision Fund. Ebonyi is supposed to implement 4 financial quarters every year. It has received 2 fund disbursements in January and in April this year, once in 2021 and 3 times in 2020. Since 2020, the state has only seen funding for 5 quarters, according to Alegu Leonard, the desk officer for the Basic Healthcare Provision Fund in Ebonyi State.
So in the first place, it is called tranches, and it comes in each quarter of the year. So what comes to each health facility is 300,750 naira per quarter. So when we implemented with 2 quarters at a go. So in that 2020, then the third one is the 3rd quarter. So that was for 2020 it was 3 quarters. Then 2021 it was 1 quarter. Then this 2022 we are already on the 2nd quarter. The 22nd quarter was supposed to have entered 3rd quarter, but due to some issues, we are still implementing 2nd quarter. So on the whole, we have implemented 5 quarters.
In recent performance assessment by the One Campaign and other stakeholders this year, Ebonyi ranked 58%. That's a wide difference from the 90% score it got in 2019 when it was assessed for the National Primary Healthcare Under One Roof Scorecard 5 assessment conducted by the Department of Primary Healthcare System Development. In view of this, one might wonder why some states have to wait for intervention funds from the federal government to make primary healthcare facilities, which is their responsibility, functional. And why is it difficult for some to pay the counterpart fund?
Well, you know that when you look at the country holistically, you see that Nigeria belongs to all of us. But each and every one of us belong to a state. So there are so many responsibilities of states that you cannot even say that 25% will have surpassed it so very well. So you cannot even access all by that 25%.
Prior to its establishment, under Section 11 of the National Health Act in 2014, with the goal of achieving universal health coverage that translates to overall national productivity through the provision of minimum package of health services, affordable and accessible to all, particularly pregnant and nursing mothers, children under 5 years, as well as the elderly. Most of the 430 primary healthcare facilities in Ebonyi State were in a sorry state, with the state government making efforts to reposition 171 selected facilities in each of the 171 political wards across the 13 local government areas in the state. This explains why the status of primary healthcare facilities not benefiting from the fund in the state still leaves much to be desired, with residents lamenting their ordeals, mostly affected being Nteziaba and Nsugbe primary healthcare facilities, all in Ebonyi local government area, which were among the facilities captured to benefit from the Basic Healthcare Provision Fund, but lost the opportunity for lack of befitting structures.
I'm living within this Nteziaba community. Take for instance, some of the people, women around this very place, they go outside and deliver. And this particular place, as you